You're watching Arkansas Style on KARK.
This segment is brought to you by QualChoice Health Insurance. Welcome back to Arkansas Style. We are still in the month of May, which means we are still taking time to learn about and spread awareness around the importance of mental health. QualChoice is the quality choice for health coverage and benefits, and they want to make sure that you have a place to turn to when you need help finding options. So today I am here with Yvette Coleman, a registered nurse with QualChoice, to share some tips on how to take care of our mental health, just like we do when it comes to our physical health. Thanks for joining us.
Thank you.
I am so happy that this topic continues to stay top of mind, really and truly, because I have something to read here too. So according to the National Alliance on Mental Illness, 21% of adults are experiencing at least one mental illness. That's roughly 50 million people. 55% of adults with a mental illness have not received any treatment, and a little more than 5% of adults experience severe mental illness. I mean, that is staggering.
It is, absolutely, and the pandemic really opened up this topic for us. You also see in those stats that, even with our adolescents, just aged 10 to 14, suicide became that number one, causative factor there, just behind unintentional injury. We had never really seen those things before, so it really did open up. But we want to give you some tips today, like how can we recover, what can we do? So first, let's look at yourself. What are you doing? Are you eating? Are you drinking? Are you doing all the right things just to get your day started? So let's plan it out. Let's make sure we have enough protein and vegetable and fruit spread throughout the day, and that way, you're staying satiated. You're not kind of down in the dumps and just crashing before you even get started. That's really hard. And then let's look at our exercise. That's just a natural endorphin, right? 30 minutes at least 5 times a week. If you don't have 30 minutes, you hear that all the time, break it up into 3 10-minute sessions. Just a brisk walk, that's very, very helpful. Sleep. How much can we talk about? If you're not getting enough sleep, you're going to just drag, and it's going to be just awful. So decrease that blue screen time. How many of us are going to bed? You still have tablets open, you have your phone open, you're not really relaxing, right? And it's important to get that done. And about 10 to 15 minutes, try to start de-escalating that. Turn off those devices, and you'll find that sleep is much more comfortable for you. Also, relaxation techniques. Just us sitting here talking, if we were to just lower our voice, breathe in, breathe out, count to 10, big difference. There's lots of apps on your phone that can help you through that. Perhaps starting your day off with a nice quote or a mantra or something that you've been working on will really bring a lot to you. And then let's look at priorities. How many times are we always saying yes, yes, yes to everything? That's another stressor that can impact on us. So let's look and see, okay, here are my to-do list, and then here are some things that I'll get to if I can. And that's going to be very beneficial. And then focus on the positives for the day. It's really a lot of negativity going out in the world, right? Well, what can we focus on that's positive? I had 10 things that I got done today. Yeah, no, maybe, well, there's 3 great ones that I got done, and that was a positive for me. So I'm going to use that 7 for tomorrow, and I'm going to knock it out of the park. And so those are the things that we really have to focus on to keep us grounded and rooted for the day. And the biggest thing is, if you can't remember anything else that I said today, if you see something, say something. If you have someone that doesn't look like things are going well, maybe they're sad, they appear lonely, depressed, talk. Hey, are you okay? Do you want to go out? Let's have lunch. Is there anything I can do? When's the last time you've talked to your doctor? Have you mentioned these things? Any of those items is just getting that open dialogue going so people don't feel alone. And that's really what I think what the pandemic exposed is, folks that just took for granted going out to work or going out to these places, and they saw people, that all went away. So now you're left at home by yourself alone. So it's really important to stay tuned to these topics and making sure that we're taking care of each other.
I mean, you just packed a lot into a very short amount of time that can really change people's lives. Because a lot of people are stuck in the mud and they are depressed. And the difference between a mental health and a physical health, I feel like, is that you can't see the mental health, but you can see the signs.
Absolutely.
So, for example, if you've got somebody who is stuck in the mud, who is maybe despondent, not connected, what have you, and you want to impart some of these good ideas, but they're just not receiving it, do you have any advice to kind of get them moving in the right direction?
Well, I think first is just that talking. You absolutely just opened it up. Just the talk, hey, let's talk just a little bit. What are your thoughts? What are your processes? And then you do want to kind of nudge them towards really getting with their primary care physician or who's a partner? You right? You know, is it a relative? Is it a friend? Building up that trust, and usually if you can get the trust factor going, you can start nudging them towards those things and looking at things in a more open and positive atmosphere.
Look at, and on our screen there, how to start a conversation.
Yeah.
Well, you are a beautiful spokesperson.
Thank you.
You know, I mean, really and truly, you give us, you know, a lot of great advice, of course, and important advice, and we want our loved ones to be in the best shape possible.
Absolutely.
So.
We have to stick together. It takes a
We
team.
do. You're right,
Yes,
girl.
yes.
Well, I've enjoyed our conversation.
Thanks so
you.
much for having me.
Thank you. For more information on how to make your mental health a priority, reach out to a QualChoice representative or visit them online at qualchoice.com. When we return, we'll chat with some of the amazing folks at Lake Point Recovery and Wellness Center about how they can help you become the best version of yourself. Stick around, you're watching Arkansas Style.